Hello, I've been asked by my director to talk to you about our suicide screening program here at the VA Finger Lakes. The program is a national initiative to find the veterans that need help and to make sure that every veteran gets the appropriate care and need the appropriate care they need. And what happened several months ago, late 2022, they initiated of a form of suicide screening that every practitioner should do on every veteran that comes through the door. Even though we're not mental health providers, and myself, I'm an optometrist, I had a little bit of pushback on doing a suicide screening. And with that, we were furnished the opportunity to have all the proper workshops, the instructions on how to do a suicide screening. We were taught the Columbia Suicide Screening Protocol. And with that, we were asked to go out and make sure if a veteran came through that needed a screening, we should do the screening on them. At first, a lot of my practitioners in my department that I brought this forward to, since I'm their supervisor, they were reluctant to do it. I myself was one of the most reluctant persons to do it as well, quite honestly. But after going through the training and realized the value of it, I assimilated the thought of the suicide screening as part of my normal routine exam. As an eye doctor seeing a diabetic, I wouldn't do a diabetic exam without knowing what the A1C was. As an eye doctor doing a screening for glaucoma, I wouldn't expect to even begin to know if the patient was on drops or not and what drops they were taking to make appropriate diagnosis. So with that thought in mind, the suicide screening came right along the whole health for the veteran to make sure their full needs are met. And what particularly happened to me, which kind of make it hit home right away, was I became a little bit more comfortable with doing the suicide screenings. And once I became comfortable with it and doing the Colombian screening in particular, I went forward to my providers. I told them how they would have to do this exam, how they would have to ask the questions, how they had to identify the veterans that needed the screening, and we role-played through the screening with it. And that worked successfully for them because I was telling them how I was doing it. I said, you can tailor it to the way you need to do it, but it really needs to be done. The take home for me came when I was doing the screening during my normal course of the exam. As any practitioner knows, when you're talking to a veteran about a history or asking them questions, you watch their body language. I had a gentleman in his late 60s. I said, do you mind if I ask you the questions? And I started asking him the questions. And he became sullen and sunk down in the chair. His mood changed, his affect changed. And when that happens, you want to look and turn and talk to the veteran and find out why that happened. And knowing it wasn't about his eyes, but it was about the screening, I became more involved with him. And I asked him, and I kept pushing him. He finally came up with, geez, I really wish someone would ask my son. He's a veteran. I said, why? Well, I haven't been able to get a hold of him for about a month. He lives in Texas, he's going through a divorce, he's drinking again, and he lost his job. So I'm really concerned, and plus his ex-wife-to-be can't get a hold of him. With that being said, I told him there's programs in place that I can get you the numbers. The suicide prevention people can call, they can do a home health visit, they will find him in Texas. So I furnished him with all the numbers for that, which number one, changed his attitude right away. He perked up, he was so happy. He didn't know these things were available for him to use for his son, who was a veteran, which was in Texas, because he was all the way up here in New York State and couldn't get there. It was really wearing on his health. So that was a blessing in my mind to drive home the need that, you might do 100 of these. If you get one, that's well worth the time it takes out of your day to do it. With that being said, I wanted to make sure after this experience that all my providers were doing them as we asked them to do for the whole health of the veteran. What we have now in place is what's called a dashboard risk management. So I can pull up every day every clinic that I'm responsible for and see which ones are done and which ones weren't done. What I noticed was, and early on, they were missing quite a few. After I presented the dashboard, they realized, hey, there's a little competition going, friendly competition, not a negative competition, but a friendly competition to hit 100% mark. And as of today, right now, the VA Finger Lakes Optometry is at 91.7%. We should be even closer to 100, but we run in the 90s now, and it's due diligence on my team that they keep preventing and giving to the veteran what they need for whole health. What I found out after doing this is that once you engage the veteran with this type of questioning, they ask more questions. And then they say, you know, I have a friend that might need some of this help. You tell them, you give them the number, and they take it with them, or they come back to you. But it builds a better relationship with you and your patient when all of a sudden we're not just doing eye care for them, we're treating their whole body and making sure they get what they need. With that said, that's what we perform here. Our numbers are well here at the VA Finger Lakes. I went on to talk to the other chief of staffs and the chief of services about how we've done it. The big take home is that you want to treat every veteran you see to the best of your ability, and we're given all the tools to make a change. And I think we're going in the right positive direction. Yes, we can't catch everybody, but you can sure try to make a big difference and catch as a number of people as you want. I also want to make sure you know that I'm a member of the VA Finger Lakes team here. We have an open door policy from my department, which I'm the chief of service for the eyes, all the way up to the director. The director at this facility has an open door policy. If we need something to better the life of a veteran, he'll make it happen. Thank you.